Everything about leg pain ICD-10 that you may not know. The ICD-10 system allows for detailed classification of leg pain based on location and potential underlying causes. This necessitates a structured approach in the report, categorizing the respective codes to provide clarity and ease of understanding for the reader. The snippets consistently emphasize the specificity of ICD-10 codes, with clear distinctions between right and left legs, thighs and lower legs, and even down to the feet and toes. This level of detail implies that leg pain is not a singular entity in medical coding and requires a nuanced exploration in the report. 2. ICD-10 codes for general leg pain. 2.1 M79.606 Pain in leg, unspecified. Code M79.606 belongs to Chapter 13, Diseases of the Musculoskeletal System and Connective Tissue, and Category M79. Other and unspecified soft tissue disorders, not elsewhere classified. Condition name, pain in leg, unspecified. Clinical information indicates pain in one or both lower limbs, including the feet, without specifying the exact location or cause. Often used as an initial code when the specific cause or anatomical location of leg pain has not been determined. Can be acute or chronic and vary in intensity. Synonyms include aching leg syndrome, pain in lower limb, painful legs and moving toes, tenderness in lower limb. Billability. Yes, M79.606 is a specific billable code used for reimbursement purposes. Related ICD-10 codes. Lists related codes for right leg pain, M79.604, left leg pain, M79.605, thigh pain, M79.65, lower leg pain, M79.66, etc., indicating a hierarchical structure. Symptoms. Pain ranging from mild to severe discomfort, constant or intermittent, may include swelling, redness, warmth, or a heavy sensation in the leg. Causes. Muscle strain, overuse, injury, poor circulation, nerve problems, underlying conditions like arthritis. Sometimes the exact cause is not identified. Diagnosis. Physical examination, review of medical history, imaging, X-rays, MRI, blood tests, or nerve conduction studies may be needed to rule out specific causes. Treatment, medications, NSAIDs, pain relievers, physical therapy, lifestyle changes, rest, elevation, compression, surgery in rare cases. Risk factors. High-impact sports, sedentary lifestyle, age-related changes, pre-existing conditions, diabetes, obesity, occupation, prolonged standing, sitting. Prognosis and follow-up depends on the underlying cause. Some cases resolve with conservative treatment, others require ongoing management and regular follow-up. Complications. Persistent pain can lead to mobility issues, affecting daily activities and potentially causing mental health problems. Code M79.606 serves as a foundational code for leg pain, highlighting the initial stage of diagnosis when the specific cause and location are yet to be determined. This suggests that further investigation and more specific coding are often necessary for effective patient management. The snippets emphasize the unspecified nature of M79.606, indicating a lack of detailed information. The presence of more specific related codes, e.g., for right, left leg pain, implies a diagnostic process where this general code might be used initially before a more precise determination is made. 3. ICD-10 codes for leg pain in specific locations. 3.1 Thigh pain. 3.1.1 M79.651 Pain in right thigh, indicates pain localized to the right thigh. Specific billable code. Synonyms. Pain in bilateral thighs, pain in both thighs, pain in right thigh pain, both sides. Symptoms may include itching, tingling, difficulty walking, numbness, burning sensation, muscle pain, strain, or soreness. Causes. Neuralgia paresthetica, deep vein thrombosis, DVT, diabetic neuropathy, iliotibial band syndrome, IT band syndrome, muscle strain, ischial bursitis, arthritis, peripheral artery disease, PAD. Diagnosis. Physical examination, potentially electromyography, nerve conduction studies, MRI. Treatment. Home remedies, ice, heat, over-the-counter medication, physical activity, weight management, stretching, strengthening exercises. Other treatments, surgery, physical therapy, prescription medication. Risk factors, overweight, obesity, pregnancy, diabetes, age, 30 to 60 for neuralgia paresthetica. Prognosis, usually good with conservative treatment for neuralgia paresthetica, varies depending on the cause for other conditions. Complications, DVT can lead to pulmonary embolism. Chronic pain and discomfort from neuralgia paresthetica can affect daily activities and overall well-being. 3.1.2 M79.652 Pain in left thigh indicates pain localized to the left thigh. Specific billable code. Synonyms: pain in left thigh, pain in left femoral region, left thigh pain, discomfort in left thigh, pain in the left upper leg. Symptoms: similar to right thigh pain, including potential numbness, tingling, or weakness. Causes: similar to right thigh pain, muscle strain, nerve compression, hip joint problems, circulatory issues. Diagnosis: physical examination, patient history, imaging, ultrasound, MRI, CT scan. Treatment: depends on the underlying cause, physical therapy, pain management, surgery in severe cases. Risk factors: similar to right thigh pain. Prognosis: varies depending on the cause. Neuralgia paresthetica often resolves on its own. Complications: similar to right thigh pain. 3.1.3 M79.659 Pain in unspecified thigh indicates pain in the thigh without specifying the side. Specific billable code. Synonyms: thigh pain. Symptoms: main symptom is pain, constant or intermittent. May include swelling, redness, warmth, or heaviness. Causes: muscle strain, overuse, injury, poor circulation, nerve problems, arthritis, sometimes unspecified. Diagnosis: physical examination, medical history, potentially imaging and neurological studies. Treatment: medications, NSAIDs, pain relievers, physical therapy, lifestyle changes, surgery in rare cases. Risk factors: high-impact sports, sedentary lifestyle, age, pre-existing conditions, diabetes, obesity, prolonged standing, sitting. Prognosis: varies depending on the cause, from resolution with conservative treatment to ongoing management. Complications: persistent pain leading to mobility issues and potential mental health problems. The detailed breakdown of thigh pain by side and unspecified location highlights the importance of precise anatomical recording for effective coding and targeted treatment. The overlapping causes among these codes suggest that a differential diagnostic process is crucial. The snippets provide separate codes for right, left, and unspecified thigh pain, each with similar but potentially nuanced causes and risk factors. This underscores the need for clinicians to specify the location of pain whenever possible to ensure accurate coding and appropriate management. 3.2 Lower leg pain. 3.2.1 M79.661 Pain in right lower leg indicates pain localized to the right lower leg, from knee to ankle. Specific billable code. Synonyms: bilateral calf pain, bilateral lower leg pain, pain in calf, pain of right calf pain, right lower leg pain. Symptoms: pain or discomfort, swelling, tenderness, difficulty moving, walking, heaviness, fatigue. Causes: injury, sprains, fractures, muscle strains, overuse, medical conditions, PAD, DVT, varicose veins, inflammation, tendinitis, bursitis, nerve problems, sciatica. Diagnosis: physical examination, imaging, X-rays, MRI, ultrasound, blood tests, vascular studies. Treatment: medications, NSAIDs, physical therapy, rest, ice, compression, elevation, surgery in severe cases. Risk factors: older age, jobs requiring prolonged standing, heavy lifting, high-intensity sports without proper warm-up, pre-existing conditions, diabetes, arthritis. Prognosis: varies depending on the cause. Many cases resolve with minimal intervention. Complications: chronic pain if untreated, reduced mobility, function of the affected limb, potential for developing secondary conditions, e.g., prolonged swelling leading to permanent tissue damage. 3.2.2 M79.662 Pain in left lower leg indicates pain localized to the left lower leg. Specific billable code. Synonyms: pain in left lower leg, bilateral lower leg pain, bilateral calf pain, pain in calf, pain of left calf. Symptoms: similar to right lower leg pain. Causes: similar to right lower leg pain, muscle strain, sprains, fractures, vascular problems, nerve problems. Diagnosis: similar to right lower leg pain. Treatment: similar to right lower leg pain, pain relievers, muscle relaxants, anti-inflammatory drugs, physical therapy, surgery. Risk factors: similar to right lower leg pain. Prognosis: depends on the underlying cause. Complications: similar to right lower leg pain. 3.2.3 M79.669 Pain in unspecified lower leg indicates pain in the lower leg without specifying the side. Specific billable code. Synonyms: calf pain, lower leg pain, pain in calf, pain in lower leg. Symptoms: unpleasant feeling indicating potential or actual damage in one or both lower limbs, including feet. Causes: similar to right and left lower leg pain. Diagnosis: medical history, physical examination. Treatment: rest, ice, compression, elevation, medical treatment depending on the cause. Risk factors: similar to right and left lower leg pain. Prognosis: depends on the underlying cause. Complications: depends on the underlying cause. The lower leg pain codes again highlight the laterality but also include an unspecified option. The causes encompass musculoskeletal, vascular, and neurological issues, underscoring the complexity of diagnosing the source of pain in this region. The snippets for lower leg pain codes, right, left, unspecified, list a range of potential causes, suggesting that a thorough differential diagnosis is important. The mention of specific conditions like shin splints and DVT indicates the diversity of lower leg pain. 3.3 Foot and toe pain. 3.3.1 M79.671 Pain in right foot indicates pain localized to the right foot. Specific billable code. Synonyms: discomfort in right foot ache, right foot soreness, pain in the right foot, right pedal pain. Symptoms: sharp or dull pain, swelling, inflammation, tenderness, difficulty walking, bearing weight, redness, warmth. Causes: injury, overuse, arthritis, tendinitis, plantar fasciitis, metatarsalgia, neuropathy. Diagnosis: physical examination, medical history, imaging, X-rays, MRI. Treatment: conservative, rest, ice, medication, to invasive, surgery, depending on the cause. Risk factors: prolonged standing, age, injury, overuse, obesity, ill-fitting shoes, diabetes, high blood pressure, high cholesterol, kidney disease. For Shako foot. Prognosis: good if diagnosed early for Shako foot, varies for other conditions. Complications: permanent foot deformity, amputation, infection. For Shako foot, chronic pain, disability. 3.3.2 M79.672 Pain in left foot indicates pain localized to the left foot. Specific billable code. Synonyms: discomfort in left foot ache, pain in left foot, sore left foot, left pedal pain. Symptoms: sharp or dull pain, swelling, inflammation, tenderness, difficulty walking, bearing weight, redness, warmth. Causes: injury, overuse, arthritis, tendinitis, plantar fasciitis, metatarsalgia, neuropathy. Diagnosis: physical examination, medical history, imaging. Treatment: similar to right foot pain. Risk factors: similar to right foot pain. Prognosis: varies depending on the underlying cause. Complications: similar to right foot pain. 3.3.3 M79.673 Pain in unspecified foot indicates pain in the foot without specifying the side. Specific billable code. Synonyms: foot joint pain, heel pain. Symptoms: sharp, dull, or throbbing pain affecting daily activities and mobility. Causes: injury, overuse, inflammatory conditions, arthritis, nerve damage, ill-fitting shoes. Diagnosis: physical examination, medical history. Treatment: rest, ice, pain relievers, orthotics, physical therapy, surgery in some cases. Risk factors: high-impact sports, prolonged standing, walking, age, pre-existing conditions. Prognosis varies depending on the underlying cause. Complications, chronic pain, mobility issues. 3.3.4 M79.674 Pain in right toes indicates pain localized to the right toes. Specific billable code. Synonyms: pain in toes of bilateral feet, pain in right toe, pain of toe of right foot, pain of toes of bilateral feet, right toe pain. Symptoms: prickling, burning, or pins and needle sensations, may include warmth, cold toes, deformity, stiffness, numbness, skin bumps, lumps, skin discoloration, swelling. Causes: arthritis, bunions, calluses, nail conditions, infections, injuries, fractures, sprains, dislocations, ingrown toenails, hammer toe, gout, tendinitis. Diagnosis: physical examination, medical history. Treatment: rest, elevation, ice, heat, over-the-counter pain relievers, custom orthotics, special shoes, foot braces, cortisone injections, physical therapy, surgery in some cases. Risk factors: ill-fitting shoes, injuries, underlying conditions, diabetes, gout, rheumatoid arthritis. Prognosis: mild pain usually responds to conservative treatment. Chronic conditions may require ongoing management. Complications: chronic pain, disability, toe loss, permanent nerve damage, spread of infection. 3.3.5 M79.675 Pain in left toes indicates pain localized to the left toes. Specific billable code. Synonyms: pain in left toe, pain of toe of left foot, pain of toes of bilateral feet, left toe pain. Symptoms: persistent or intermittent pain, swelling, redness, difficulty moving, bearing weight, tenderness, may have numbness, tingling. Causes: injury, inflammatory conditions, nerve compression, osteoarthritis, infections, fungal infections, underlying conditions, diabetes, gout, rheumatoid arthritis. Diagnosis: physical examination, medical history. Treatment: pain management, physical therapy, medication, orthotics, surgery depending on the cause. Risk factors: similar to right toe pain, plus conditions causing peripheral neuropathy, diabetes, alcohol use disorder, vitamin deficiencies, autoimmune conditions. Prognosis: depends on the underlying cause. Complications: depends on the underlying cause. 3.3.6 M79.676 Pain in unspecified toes indicates pain in the toes without specifying the side. Specific billable code. Synonyms: pain in toe, toe pain. Symptoms: pain may be accompanied by numbness, swelling, or skin discoloration. Causes: ill-fitting shoes, underlying conditions, arthritis, peripheral artery disease, injury, infection, nerve problems, e.g., hammer toe. Diagnosis: physical examination, medical history. Treatment: rest, elevation, ice, over-the-counter pain relievers, orthotics, shoe modifications, surgery for deformities like hammer toe. Risk factors: ill-fitting shoes, family history of toe deformities, conditions like arthritis and diabetes. Prognosis: varies depending on the underlying cause. Mild cases often improve with conservative treatment. Complications: chronic pain, disability, potential for infection, nerve damage. The detailed classification of foot and toe pain highlights the high specificity of the ICD10 system. The overlap in causes, e.g., arthritis, injury, ill-fitting shoes, across different locations suggests common underlying mechanisms for foot and toe pain. The snippets for foot and toe pain codes provide a comprehensive view of potential causes, ranging from mechanical issues like ill-fitting shoes to systemic diseases like arthritis and diabetes. This emphasizes the need for a thorough clinical assessment to accurately determine the cause of pain in these distal parts of the leg. 4. ICD-10 codes for leg pain due to vascular issues, atherosclerosis. 4.1 I70.221 Atherosclerosis of native arteries of extremities with rest pain, right leg, belongs to Chapter 9, Diseases of the Circulatory System, and Category I70, Atherosclerosis. Specific billable code applicable to adults, 15 to 124 years. Indicates atherosclerosis in the native arteries of the right leg causing pain even at rest. Symptoms: Rest pain in the right leg, potentially progressing to numbness, may also have leg pain with walking, claudication, cool skin discoloration, non-healing wounds. Causes: atherosclerosis, plaque buildup in arteries. Risk factors include smoking, diabetes, high blood pressure, high cholesterol, older age, family history. Diagnosis: medical history, physical examination, checking pulses, signs of ischemia, ankle brachial index, ABI, Doppler ultrasound, CT or MRI angiography, cardiac catheterization. Treatment: lifestyle changes, quit smoking, healthy diet, exercise, medications, antiplatelet drugs, statins, blood pressure and diabetes medications, angioplasty and stenting, bypass surgery, endarterectomy. Risk factors: older age, male sex, diabetes mellitus, cigarette smoking, hypertension, increased lipid levels, family history of atherosclerosis. Prognosis: varies depending on severity and management, can range from no change or improvement to progressive symptoms requiring intervention. Complications: critical limb ischemia, tissue necrosis, non-healing ulcers, gangrene, amputation, increased risk of heart attack and stroke. This code specifically addresses advanced peripheral artery disease where pain occurs even at rest, indicating severe reduction in blood flow and a high risk of limb-threatening complications. This highlights the critical nature of diagnosing and managing vascular causes of leg pain. The snippets for I70.2.1 clearly indicate the progression of PAD to a severe stage characterized by rest pain. The emphasis on risk factors like smoking and diabetes, along with the mention of serious complications like amputation, underscores the importance of early detection and aggressive management of this condition. 4.2. I70.222. Atherosclerosis of native arteries of extremities with rest pain, left leg, similar to I70.2.1 but affecting the left leg. Specific billable code applicable to adults, 15 to 124 years. Indicates atherosclerosis in the native arteries of the left leg causing pain even